Well, it's interesting when you look at this chart. In this particular example, 40% of their denials were due to insurance coverage. So I take it that means this patient, we didn't even file it with the right insurance.
Actually, no. In part, it is. This is actually probably the #1 denial reason across many of our clients. And what we're seeing is that not all practices have an insurance verification process in place. They either don't have the staffing for it, they don't have the appropriate tools in place to check eligibility and verify insurance. So what we're seeing is it's coordination of benefits issues. The patient has 2 policies, and both think they're primary, so there's a COB issue. The second is it's either terminated benefits. The patient no longer has that insurance coverage, and we have seen this area of denials grow within the past 6 months because of the fact of patients losing their insurance coverage. They've presented an old insurance card to the practice, and that is how the front desk staff registered the patient. Yeah. So this speaks to how important it is that you do have someone in your office check eligibility.
I think what's so important about this denials analysis discussion is for many practices, if the AR is up or the cash is tight, the traditional answer is go beat on the people working claims and tell them to work harder and call more insurance companies and let's get these claims paid. But the truth of the matter is when you look at this denial summary, the root cause for denials is on the front end of the process, either at the front desk or with the clinical folks. And the people working claims on the back end sometimes have their hands tied. If you didn't get a pre-authorization, we're not going to get paid.
That's right. As you can see, the majority of what's here is it started and the root is at the clinic.
So this lets you, a good denials analysis will let you know where your problem is. It shows up in AR, but your problem is somewhere else, and this will point you to what you need to go fix.
Right.
Now, in addition to the denials, logic would say that one of the most important things is comparing what you got paid to your contracted rate. Did the payer give you what you had agreed to? And everybody talks about this, but actually not very many practices are able to do it. Why is it hard to compare actual payment to contracted rate? And how much is it worth? What's the value in trying to get it right?
Well, it's very valuable to monitor this, and you're absolutely right. It is difficult to monitor because many practices do not have the allowable information. Contracts were signed many years ago, and they just don't have a very good record of what the contracted rates are. But it is very important to monitor because what we have found is as we've developed these reports to monitor what we call the allowed analysis, as we've identified some of the major payers routinely underpaying practices for their E&M services. Everyone expects a surgery to be underpaid, and everyone's watching the surgeries, but what not everyone is watching is your routine office exams.